Welcome to Stifel's Sightlines podcast, focusing each week on a topic or two important to investors.
Well, greetings and welcome to the Sightlines podcast. This is Michael O'Keefe, Stifel's Chief Investment Officer. We've been doing a few episodes on artificial intelligence, and we want to continue that discussion with a focus for the next couple of episodes on actual applications where we're really seeing AI kind of jump into use, if you will, in different areas. And in this episode, I want to get into specifically healthcare. So obviously, if you're listening the last couple, we talked a bit about how AI is and will be impacting the labor market. We've talked about it from the perspective of how an investor might analyze how companies are using AI and looking for effectiveness, basically, return on investment, if you will. And we've talked about over time how artificial intelligence influences our long-term themes. So just a lot going on. And again, just wanted to take the opportunity specifically to talk about healthcare because it's really accelerating quite quickly how much AI is being used in the healthcare space with, of course, a lot more to come. And so let's kind of get into it a little bit. I guess the first thing I'd say is the idea of adoption. And I'd say the general tone that you're hearing is that physicians in particular might be a little bit more cautious, but when it comes to clinicians, and that, expands it to include nurses and PAs and other folks sort of in the area of healthcare, sort of supporting the whole overall process. Essentially, what we're seeing is some adoption. 76% of clinicians have used AI at least once in some form or another. And then when we get into some real sort of practical applications, the first one that comes to mind is analyzing images. Essentially, it's say maybe a fifth of the clinicians are actually using image analysis done by AI today. So it's a pretty actively used thing, but obviously with a lot of upside from there. And there's a view by more than half of those individuals that they're sort of expecting, think of it as all the images to be analyzed by AI almost in advance, looking for abnormalities, that could be the case within the next few years. On kind of a related note, some specific imagery stroke analysis, studies have shown that the AI support is the software that they are applying to this are about 2 times as accurate as a person looking at the scans. So there's this whole sort of belief that it's almost like discovering things, the AI is going to get so good, probably discovering things that maybe the human eye, won't be able to see right away. So on a related note, and this relates kind of to precision medicine, drug discovery, all supporting longevity. There are models being developed, from what I understand, that will be able to detect early signs of over 1,000 diseases before the symptoms appear. So again, it's an interesting thing to ask about how AI can ultimately be used to kind of go deeper, better understand what's going on. And then, as we've talked about, I think in the past, the idea of AI being used for precision medicine, imagine, surgery that has to be highly precise and sort of a robot doing that. Or the other area where we're seeing a lot is in drug discovery, basically the research to decide whether a drug can be effective. And so anyway, that's all very positive. Now, I would say, I mentioned at the beginning that physicians in particular are a bit wary of new tools. And so that is a little bit of a headwind today. And, have to keep that in mind. And, as another example of a headwind, the regulators, so think Food and Drug Administration, they're going to treat AI tools sometimes as software that's a medical device and that requires all kinds of testing and documenting results and monitoring things and all that. So, again, some sort of known frictions, if you will. But still, the potential is pretty big. A couple other interesting facts. Think in terms of reaching underserved areas. So the World Economic Forum estimates 4.5 billion people lack the full healthcare that they need. And so there's work going on to basically pair AI with clinicians to better serve those regions, right? And so it's almost like this ability to scale in a way that will be interesting. Another area that is in focus, which is second order, but really still kind of your typical interesting business analysis, is if you think about things like processing paperwork, if you think of things like how data is stored, if you think about all the frictions that we all experience in the healthcare system, the idea that AI can be used to better improve those processes, the workflows, if you will, and sort of in the end, hopefully, support things being done a lot faster, things being done with lower error rates, and for example, that providing that much more support to a more robust sort of digital record storage and availability. And so again, it's still kind of early days, but what's interesting is when it comes to sort of helping people with their health, it's clear that AI is already playing a role. And then, inevitably, it's still very early days. So when it comes to that, combined with helping people that can't get to healthcare, or, the sort of the improvements in terms of operations, there's still, if you will, a lot of upside from here. Anyway, so that's what we wanted to get into in this episode. More to come. Again, we're going to dive into a couple other areas in the next episode when it comes to the application of AI. But thanks very much for listening to this one, and we'll catch you on the next one. Thanks.
Thanks again for listening to Stifel's Sightlines. Be sure to subscribe wherever you're listening to automatically receive each week's podcast in your feed.